I would say the principles and the concepts are really the same. I think it comes down to leadership into vision, sharing that vision, and communicating that vision with every opportunity that you have. The thing around the informal training process that Mr. Brown spoke of earlier, I think is very powerful. And that's where your coaching and mentoring comes in at. But people have to know what those things are. And then starting to really look at the human component here. And DJJ, we're somewhat different, both in size, but also staff understand now that every youth that's within the organization will at some point go back into the community, except for a few that wouldn't go into adult prison because they're Superior Court commitments. And as we talk about public safety and you talk about staff safety, our staff have a commitment to public safety, but understanding that simply locking people behind doors and the strong security and control measures are not necessarily making things safer. So it's communicating those things, but you're really talking about changing people's values, thoughts, and beliefs. And I think those things translate across the organization into any arena.
Thank you. And Mr. Brown, do you, we are interested in the mentor programs that's come up, or coaching, which is, I guess, is another way of saying that. And interesting, for me, I was in a state prison with Senator Bell, actually, a couple of weeks ago, and the idea of coaching actually came up from a discussion with correctional officers. They said that they thought it would be good to break the academy up or something and have some weeks back in the institution, and then have some time when they could regroup and just compare notes and get ready for the rest of their training. Do you know of any examples of anything like that, or?
There are some states that are doing some of that. It's in experimental stages. But one of the, if I had one wish, I would love to have a model of the behaviors we're looking for put on DVDs, put on tape, but it's more DVDs today, so that a supervisor can't remember everything. But isn't it great if you observe behavior that's inconsistent with what we're trying to get accomplished at the institution? If we could take 5 minutes out, 10 minutes out. And I wrote down roll call training when Mike was speaking. I wrote down roll call training. It was a time LAPD would march every one of their officers out the front door down to get some training, 15 minutes worth of training from time to time. We need to bring that kind of orientation into the institutions. I know you all have collective bargaining rules about what you can do, what you can't do, but to break up in bite-sized chunks, the behaviors that you want to reinforce, and to have those available so that people can observe, can review, can see the correct way of acting on the behaviors that you want to get accomplished in your corrections facility that it doesn't take away from security, but it reinforces the lessons that are important for modifying the culture of your organization correctly. And that's with agreement. Stacy said, bringing in the subject matter experts to get their input and then to capture that input and to be able to demonstrate that input, not from a supervisor who's got to be left to his or her own devices, but have it available so that they can watch it in bite-sized chunks. And it's here and now training when it's required, when it's needed. When a supervisor makes an observation, we can act on it.
Well, I think that's a very interesting idea and something that we might want to try.
Senator, I would tell you this, that if the state of California wanted to work on something like that, we would be very interested, because this is a bellwether state system that others, the Secretary said it right here. He said, we get calls. And if you can provide leadership in the direction of having an appropriate or correct, and I'm not saying that an academy is incorrect. What I am saying is having an alternative approach to training that is cost effective, that can be done. We would be very interested in partnering with you on something like that.
I'm interested
as an experiment
also
to see how well it works.
That would be a very interesting thing for us to think about. And I'm interested in the kind of peer support, again, that is used in schools sometimes, where teachers get together and actually talk about the people they're working with in the sense of somebody isn't doing so well, what do we know? What have you observed? Here's what I've observed. How do we help that person? Or how do we praise them because they're doing really well?
What are the strategies that will work? How can we share those strategies? How can we improve value-added levels of service delivery, particularly around training, that enhances training, that doesn't take away from it?
Right, thank you. And then to Mr. Alexander, I would just say, we are all concerned, I think, about, for example, the officer suicides at places like High Desert, and officer feedback about the stress in their lives. And but besides money, are there any specific suggestions that you might have for specific training is also a funny word. I don't actually like the word training that much. I like preparation because people have to use their minds and hearts all the time in doing complicated work like this. But would there be specific ideas, like based on feedback that you get from your officers, or how do you think a mentor coaching program would go, or peer support?
Yes, ma'am, and I didn't mean to sound flippant in my statement about money, but the fact is our training, the last number I got, an hour's worth of training for the officers across the state is about $1 million an hour. And historically what has happened, every time the general fund budget gets in a bad way, the training is the first thing to go. The academy gets shut down, which has happened twice in the last decade, and then we pay for that for 3 years running after that. Our training at the institutional level gets shut down to save money. So I was just trying to illustrate that effective, real, tangible training is expensive. It's not on the cheap, so to speak. The vast majority of the training we get ongoing at the institutional level is module-based, written-based, email-based. We don't actually get that much hands-on question and answer type expert training. As far as a mentoring or coaching program, I think that has great merit. We tried very hard to get a field training officer program established with our last contract, and we just couldn't get it done with the staffing matrix that exists in our facilities. It just wasn't plausible. So I would be very supportive, we would be very supportive of increasing the cadre of supervisors, first-line supervisors, to avail ourselves to some kind of mentoring, coaching program, as I've heard dialogue about here a little bit. I'm not real familiar with it. Conceptually, I think it sounds very meritorious, but whether or not it's applicable or in a real-life scenario, I wouldn't know, particularly with the staffing matrix that we have in the adult side today.
Standardized staffing?
Standardized staffing is part of that, yes, ma'am.
What you mean? Oh, okay, I just...
Well, I mean that there's, my experience at a level 4 institution, there's 2 sergeants on the yard, assuming one's not been diverted to cover a vacancy somewhere else, and that sergeant has somewhere in the neighborhood of 40 or 50 people to mentor. That's just not going to happen. It's just not, it's not that good staffing-wise to do that. So there are problems with that. And that goes back to us trying to get the field training officer program up. We've also advocated, and it's still in our contract, albeit our contract is expired right now, we have an apprenticeship program with ratios built in for apprentices to journeymen, which is kind of online with a mentoring, somebody that has some time in the department that knows a little bit can help out somebody new that's just arrived. And we have many institutions that are unable to meet that criteria. So we are very supportive of that concept, and we'd like to see something done with that, absolutely.
Okay, thank you. I appreciate that, because what it basically takes is everybody sitting down together and working this out, and I look forward to that discussion. I don't know if there's any other questions. Senator Bell.
Thank you. Thank you, Madam Chair. Just a question, Mr. Brown, if you could. Have you seen any state that has, or the federal government that has training on addiction issues?
The addiction issue is now being looked at really as a medical issue more than,
Right.
and, you know, that's where you're going to see it shift. I believe that's where you're going to see it shift. I mean, we're 6-8 months away from a new president and a new attorney general, but I think you're going to see that moving away from an issue in incarceration to an issue of addiction, and it's going to be handled differently, very differently than, because our population, the federal population, 40%, if we could eliminate 40% of our population, we'd be in a much stronger position in order to be able to deal with the correctional population that needs our services, as opposed to a group that has other kinds of needs. I mean, that's part of what the jails are faced with today. If they had more community interventions, if they had more community services available to them, then we could divert a number of folks out of a concrete building, out of a cement block building, and put them in community services where we could probably get a bigger return on our investment.
Are there any states that have those kinds of programs?
Not that I'm aware of that's a uniform state program. It's something that will be our agenda. The National Institute of Corrections, it's our agenda issue moving forward.
Well, the reason I'm interested is, you know, we have this special master here for healthcare, and they excluded addiction issues. So I think it was a flaw, actually, my opinion. I mean, how can you deal with health if you don't deal with addiction issues? So it was I think there is no plan, if you want to say it that way, for addiction issues, other than now we're being asked to put more money in for, you know, purchasing dogs, screening devices, other kinds of things. So we're being asked to spend money on, you know, trying to prevent drugs coming into the prison, but we don't have a plan to deal with the training and the planning for that particular problem, okay?
And
So I kind of, in terms of training, that kind of worries me a lot. Something I'll probably focus on. When we did the bill on mental health, by the way, we had two bills, actually. We had one bill for the police officers to do the academy training, and then one bill, so SB 11 was for academy training, and then SB 29 was for the field training components that you were talking about, you know, the mentor training, and developing curriculum for the trainers kind of thing, you know. So we in terms of what we approached it as, is first train the trainers, and then have the trainers, I guess, sergeants for the corrections department. You want the analogous person in a police department to train the trainers in terms of how to go about field training the staff. And then what it did is allowed a cycle of training over time to finally end up having all the staff trained. So over time, it wasn't like all at once everybody would be trained, but over just a cycle, kind of a cycle over time. And I'd be interested if that approach might be something that might be more cost effective, I think, in terms of, like, when you were saying the $1 million cost, that might be a way to do it if we worked with the corrections department on that. And I don't know if you have any comments on that, Mr. President.
I'm not sure I understand what you're talking about relative to how to get it done, other than the mentoring program. As I understand, you're talking about
Like cycling in the training, not just trying to do it all at once, you know, like.
Oh, sure.
But over time, you know, kind of cycle it in to make, over time, have all the staff be trained at some point. I think that's the way the Highway Patrol did. Now they have 8,000 people that are trained completely now. They finished their cycles. So they finished all the Highway Patrol officers now have training now.
I do have one other quick question, and then we're going to go to public comment. If there's any people here would like to comment. There's a really interesting paper from NIC that I read, which was on occupational stressors in corrections organizations. And they talked about traumatic exposure and the impact it has on correctional officers. And they said there's two kinds. One is firsthand experience, and the other is secondhand experience, which relates to the tone in which communications are given, the tone in which training is done, and they referred particularly to an us versus them ideology in many correctional institutions. And that in effect leads to anger, social isolation, and some of the other destructive behaviors that, that we have seen. And I'm wondering if the NIC has done any work in relating to the rhetoric, I think they actually call it the rhetoric, that is used in correctional institutions and in our training. Because again, that isn't something that necessarily costs money, and it seems to be what Director Minor was describing pretty much as in terms of what you did in the juvenile institutions, and a little bit what was going on in Valley State Prison when it changed from a women's prison to a male prison. I mean,
We're in the beginning stages of that. The desert, we're working with Desert Waters, but beyond that, we have some other folks that we're working with over in Maricopa County who are, they've had some firsthand experiences with this whole issue of fatigue that doesn't impact you immediately. I mean, there are horrific things that you experience.
Yeah.
But it's when you write the wrong pre-sentence report and that results in something that occurs some distance and then somebody accuses you, or you simply walk away with the burden of the decision that you made ends up being the incorrect decision, and it ends up with somebody being seriously psychologically injured more than physically injured, and you have to deal with that burden. It impacts, and it takes a highly proficient probation officer in this case. It moves her from being effective to being almost useless on the job. And it's a major problem that we've got to come to grips with. This is a dangerous business. We see things, we experience things, we get criticized in the press, and in some cases we carry the burden of that away with us. And we've got to learn how to deal with that more effectively. And that's us being responsible. I think the Inspector General talked about that. We want to support you so that you can deal with these traumatic issues and problems effectively, so that it doesn't bring you to a point where you're incapacitated to be an effective probation officer, correctional officer, whatever the role is that you're expected.
right. And I will be interested in whether you think maybe we need a component in even our basic academy about reentry, just to remind us that over 90% will be going back to the community. And we want, as they say in Norway, we want them to go back as safe neighbors.
I think we talked a little bit, or you may have talked a little bit about, can we break the training up incrementally? I think what Senator Bell suggested in terms of what the Highway Patrol did, in terms of training a force of 8,000, was it 8? Yeah, over time. There's a limit to what you can get done in the academy. So what are the priority issues that we need to address in the academy? And then are there some other issues that along the way we need to do back home at the institution that fit what the needs of the institution, what those are in terms of crisis intervention training? If that's an issue for us, the mentally ill in our prison, if that's an issue, restricted housing, if that's a key issue for us at some institutions but not at others. And I know that one size won't fit all. One training experience won't fit all. Now, there are some key competencies that a correctional officer has to master in order to be effective. But then beyond that, what are the unique issues that we need to address institution by institution, or multiple institutions? It may be multiple institutions.
No, that's very interesting too, because there are models of school change
Yes.
in which you start with the leadership and the staff, and everybody works together to define what would make their life better in that school, how they would become a more successful school. So maybe we'll explore all of these things. Okay, Senator Bell, and then we'll do public
I
comment.
forgot to ask this question. In California, our corrections department, we have a corrections department, and then we have private institutions that take thousands of our inmates, okay? The question might be, have you looked at, Mr. Brown, the private institutions, and are they in the same ballpark as what we're talking about here? What in terms of training, competencies, getting the care that the level of competence we want, how do they go about doing that, in your opinion? Have you looked at that, or is somebody else looking at it?
We've looked at that. Now,
Okay.
what I would say to you is, lower security level inmates, less services, those tend to be what the private facilities deal with. They hire, if you're looking for a second career, if you're a warden or a senior level leader for the Federal Bureau of Prisons, it's an open market. There are places to go to work. However, when you drop below that level, the correctional officer workforce at the privates versus your correctional officers, there really is not much of a comparison, because you've got a better, even though you may have blemishes, you may have issues and challenges, your correctional officers, by and large, are better trained, better educated, better supported from theirs. And even though I've said some things about supervisory training that I think needs to be an addition to what you're doing, mentoring training needs to be an addition, by and large, your correctional workforce is far superior and better trained.
So get what you pay for, I guess you might say.
Yes.
I don't know if you have a comment on that. You probably do, I'm sure, but I welcome your opinion.
Well, thank you, Senator. I don't know that I want to open that Pandora's box too far, but.
But I thought I'd ask it because we're talking about training, and I think it's important that we recognize we have Californians that have committed crimes that are in these private institutions, and
Generally speaking,
we all want them to come back and be safe neighbors, as Senator Hancock says. So.
the private institutions, generally speaking, cherry pick their population, so you can pretty much guess what they pick, and we don't get to do that. We have to deal with what we have sent to us by the courts, and I'm not denigrating the training that we do have. My experience, having traveled a number of places, is we are one of the best trained in the nation. Currently, right now, I think we could be better trained, but we are, in my opinion, by and far one of the best trained. So I would concur that you get what you pay for.
Okay, thank you.
Okay. Are there any comments from the public? Please come forward.
Kieran Savage, National Alliance on Mental Illness of California, NAMI, California. And I really want to thank you for taking a look at this issue. And I want to thank Senator Bell for the bills that you authored last year for improved training for law enforcement. And we would really echo the comments to increase the amount of mental health training that correctional officers get. And I think this is important both for the interactions with inmates and also for the mental health of correctional officers themselves. And one of the things that we've seen and heard when we do training with law enforcement that's particularly helpful for them is hearing the lived experience perspective of individuals and family members who live with mental illness. So we would encourage the department to consider including that in their training. It's also cost effective. It's something that is offered on a voluntary basis. And in the discussion of volunteer programs that are extremely effective, one thing that our organization has seen, and we're able to offer some of our educational programs and support groups to a limited number of jails right now. So one thing that we've thought about a little bit is what is the support that we're also providing to family members of correctional staff. We think that's really important when we're thinking about their health and well-being and the family unit, particularly when we do know that our correctional officers are oftentimes living with post-traumatic stress disorder, that this does have an impact on their family. So to the extent that we can also offer programs to their family members, we think that that's a really important and effective thing to be doing. So thank you very much.
Thank you very much. Are there other comments from the public? Well, seeing and hearing none and having run half an hour over time, I think we'll close the hearing, but I really want to thank all of you for taking your time, for sitting through this and listening to one another. I look forward to working with you on some improvements and reforms that will give our correctional officers the tools necessary to work safely and more productively in prisons, and to be part of a rehabilitation team, and really join this great mission of turning around what corrections is about in this country, because it is coming from the very top federally down to talking to the COs and others connected with the prison system and hearing how they think their lives could be safer and more productive and more rewarding. So thank you all very, very much. And this is just the beginning of the conversation, I hope. The meeting is adjourned.